glad my committee got here nice and early so we didn't have to sweat out a quorum. First order of business is to approve the Health, Human, and Social Services last month's committee meeting minutes. Motion made by Supervisor McDevitt, second by Supervisor Bramer. All in favor?
Aye.
Aye.
Opposed? Carried. Okay, Chris, you are first on the docket here. Take it away.
Great, thank you. I appreciate it. I have 4 items before you this morning. The first one is a request to amend the county budget to add Trade Adjustment Act funding. This is for 4 customers. And I apologize, I just realized on the agenda it says 2, but on the actual resolution it does say 4 for 4 dislocated workers, total of $20,823.
Motion to get this done. By Supervisor Bramer, second by Supervisor McDonald. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
The second one is a request to appoint or reappoint a member of committee, board, or agency, and this is for the Saratoga Warren Washington Workforce Development Board. I'm asking if you would appoint the new, not so new anymore, President and CEO of the Adirondack Regional Chamber of Commerce, Tori Riley. She was a member of the board at a previous job, and ARCC has typically been a member on the Workforce Development Board.
Motion made by Supervisor McDevitt, second by Supervisor Vansville. All in favor?
Aye.
Opposed? Carried. It
The
is Monday. Keep up, people. Keep up.
The next one is a request to host a meeting or a conference. It's our turn to host the Workforce Development Board meeting. We're proposing that we hold it on the 9th floor at 333 Glen Street. I don't have the time or anything yet, but I'll certainly get it out to the members, and if you're interested, you're certainly welcome to attend. It's an open public meeting.
You need a resolution for that?
Yeah, because we're going to spend money.
Oh, okay.
And it's on the agenda request. I think I requested up to $400. I think last time it was $300.
Oh, okay, gotcha.
Because we have, refreshments.
It's a beautiful spot.
Yeah, and they charge for the room.
This is one of the bigger rooms that we're not.
Yeah, it's on the 9th floor.
Oh, okay, yeah.
Good. Motion made by Supervisor McDonald, second by Supervisor Bramer. All in favor?
Aye.
Opposed? Carried.
And the last one is a little unusual for me. I have not done this previously. The county has been involved with the Adirondack Health Institute, and they have a training fund. And I was at a meeting a couple of weeks ago where they were talking about their training fund, and I said, well, could the county apply? We send people to healthcare related training all the time. And they said, oh, sure, I don't see why not. They're actually having a hard time spending the money. And so I had some conversations with staff, and they encouraged us to apply. We currently have 14 customers that have been approved for training, totaling $33,414. So that would be the grant request to the Adirondack Health Institute. They review these requests on the 15th of every month. The actual application is only about 5 pages, which is included in your package, and includes some of the relevant information. I don't know if there's any questions.
A motion made by Supervisor Bramer, seconded by Supervisor McDonald. Discussion?
Just to highlight, so for the county, through our Workforce Investment Opportunity Act, it would be considered program income. So what it would do, it would expand our ability to send additional people to training this year. So that's really the benefit for us. Our training funds are limited this year. Our overall budget was cut by about 10%. So this is a way to make up for that lack of training funds in the current year.
We do have a motion and a second. All in favor?
Aye.
Opposed? Carried.
And then finally, information for your review. We're hosting a job fair. It's actually sponsored by the Workforce Development Board on November 9th. It's going to be on the 2nd floor at 333 Glen Street, and I did have flyers there for everybody. There will be some paid ads that the businesses are going to take out in the Post-Star and Chronicle, and maybe even some radio ads, but just to make you aware of it. You'll see there's a new logo at the bottom left corner that we are now being required to use, the proud partner of the American Job Center Network. A couple of years ago, I was at a meeting, and they had a representative there from the Boston Regional Department of Labor, and he said the career centers have more storefronts than Target, but nobody knows what we're called and who we are. So this is the national, branding, effort, this American Job Center. So that's for your information. I'm all set, unless there's any questions.
Any other questions or comments for Chris?
Great,
Okay.
thank you very much.
You have a good week, Chris.
Yeah, you too.
Rob, York from Mental Health, you're next, pal.
Thank you.
Okay, I think everyone else has an agenda. Just have two quick items. First is a resolution request for a budget amendment to accept some 2016 cost of living adjustment funds from the New York State Office of Mental Health. In your packet, there's a resolution request form and an attached Schedule A that details the amounts, increases for our various contract agencies. It totals $9,365 total.
I never noticed, but is that an acronym for People Incorporated? Is that why the E is small in that?
Yeah, that actually is an acronym. Let me think what that stands for.
I mean, we'll take the $200, but
Something empowering, I can't remember what it is
Empowerment of people that are psychiatrically labeled or something like that.
Okay.
Kind of an awkward term, but they operate the Warren Washington Rose House. It's a peer-run respite program in Glens Falls.
thank you. Okay, we need a motion made by Supervisor Bramer, seconded by Supervisor Vanslo. All in favor?
Aye.
Opposed? Carried?
Okay, second request is on the back page there, is a request for a new position. Our secretary, office specialist Cindy Wasson, is planning to retire in January 2017, and this is a request to bring on somebody temporarily in December to an office specialist number 2 that would allow for a month's training overlap. We do have funds for this within our budget, transfer funds.
I'll move that.
Motion made by Supervisor Bramer, seconded by Supervisor McDonald. Any discussion? All in favor?
Aye.
Opposed? Carried. It's a good move, Rob.
Thank you.
Can I just ask Rob a question before? Rob, the funding as it relates to heroin addiction in the two counties, do we see anything hopeful in that area as far as additional funding, maybe statewide or national-wise, or?
Well, yeah, the New York State Office of Alcoholism and Substance Abuse Services is identifying additional funds targeted toward that. They have a couple of RFPs out right now. The Council for Prevention is looking at some of that funding. And we also, our Community Services Board has made actually a direct appeal to the office for funding for the council to continue to support the work that they've been doing. They have a coalition, you know, you've been part of it, for your involvement. And so we're trying to advocate for more funding for them.
I think the one issue that kind of caught my attention, I think I was chatting with Dave Saffer, his budget, I think it's been static for the last 5 years, which kind of, you know, with all of the activity and effort, that just seemed that maybe we ought to be doing a little better in that regard. So.
Yeah, I think the Community Service Board felt the same way. In fact, they passed a resolution directing me to advocate, you know, directly with OASS for additional funding.
Good, thank you.
Anything else for Rob? Hey, Rob, you have a good week as well. All right, next we have Countryside and Social Services. No, I'm just kidding. Come on up, Deke.
We can do them all together. I'm used to it that way.
Sure you can.
Yep.
I'm feeling it. Matt and I are with you.
See somebody.
Oh, it's before 9:30.
Sign right here. Right, sign it right.
Know the drill by now?
Still run out of, shavers?
I just get my soul from market now.
Sorry, I'm late, I'm trying to fit two things in.
That's all right, Edna.
We thought you'd be at the
We
SOC
thought-
conference.
Exactly. Okay, sorry about that, Dee.
That's okay.
Go right ahead whenever you are ready.
So I have one item today. It is permission to enter into a contract with Hamilton County to provide, heat outreach and services to the community residents of Hamilton County.
Okay, we need, motion made by Supervisor Seaver, seconded by Supervisor McDevitt. Any discussion on this? All in favor? Oh, I'm sorry, go ahead.
Oh, I'm just curious why we're doing this for Hamilton County. I mean, do
Why
they
we provide the
they
service?
reciprocate? Yeah.
Because we are the OFA for Washington, for Warren and Hamilton County, so we provide services
Gotcha.
for them as
Okay.
well. This one, it's not something that is a cost to us, it's something that they reimburse us.
Okay.
Okay, we have a motion and a second, all in favor? Opposed? Carried. Anything else, Dee? Okay.
How's it going?
It's going good. I'm not drowning anymore, I'm just waiting a little bit in the water.
Okay.
It's getting better.
Congratulations on that.
Shoulders above water now?
Yeah,
Good.
yeah. Thank you.
Yep.
Thank you.
I know.
That boy did a 2 minute survey all the time, if you know what I'm saying.
Yeah. They
What?
do.
Yeah, they're dropping
Yeah,
like
you-
flies.
Yeah, it's not that bad. Yep. Okay, ladies, we are ready whenever you are.
I believe I'm ready. So, good morning, everybody. My first request, resolution is notice of intent to fill the vacant position of Assistant Social Services Attorney, salary range 63 to 68,000, employee number 12857, effective November 30th, 2016, due to resignation. This is a mandated position.
Motion made by Supervisor McDevitt, second by Supervisor Frazier. Any discussion? Supervisor Seaver.
Thank you, Mr. Chairman. I don't know if we need to go into executive session or not. I certainly don't want to talk about someone's particular employment or why they're leaving, but in general, I think as a board, we've noticed there's a lot of vacancies, and just wondering what's going on, or perhaps generally what a reason for resignation might be, or is there something more that you need from the board or support to try to reduce the vacancies?
I think we should go into executive. I don't wanna talk about, reasons people are going in front of everybody, 'cause I don't think I necessarily have that position, so.
If it's something general, I mean, if we're gonna talk about the specific person, then yes, but if we're gonna talk about general policy or what's happening in general, I don't think we should go into executive.
Okay. I think
I would,
people
I
are
would
looking.
agree with Claudia, that, if it's, we're not gonna talk about a human being, we're just gonna talk in
Right, if
generalities.
we're talking about the employment history of a particular person, then I think we need to go into executive session.
Right, but just to clarify, my question was more generally,
More general.
Okay.
it seems like there's,
We've had a few
yeah.
resignations, and it
I
seems like
think
every
that-
month there's a request to fill a vacancy for
Right.
resignations.
I think most of them are related, actually for two reasons. The first one is people are looking for more money, and maybe more flexibility than, the positions here allow. And, the other reason was that the job for, like when the caseworkers, we had a big round of those caseworkers that left, and all of them talked about the stress related to the job itself, the on-call work, that was extremely stressful for them. And the people that left for reasons of stress were willing to take a cut in pay. But most of those jobs were lower paid, but they didn't want to have to deal with on-call anymore and going out at night and having their weekends, because now weekends, we're seeing people that are on call 16 to 24 hours for the weekend. So when you start Friday night and you end on Sunday night, or early Monday morning, it doesn't seem like you had any time off. It takes you a long time to recover from that, because you're going into situations where you don't know what's going to happen, and I think that just takes more out of you also, that who knows what this call is going to be. And
not only that, I believe in the beginning of the year, didn't the state take away a lot of our, I know in public health they took away a lot of employees, but I thought for sure it was DSS as well, no? Albany went down there. So they were just paying them more money. Go ahead.
Just in reply, I mean, I think that's been something we talked about over the past year with the changes in the Medicaid, right? But what I'm specifically noticing in the last, 4 to 6 months, I guess my question is, are we looking at the way some other counties are doing it? Perhaps are there caseworkers that are just assigned to on-call? Are there different models? Are there things that we could be looking at a little bit differently outside the box I know it's tough to be creative with the state, but by sitting in with some of these committees at NISAC, I'm able to hear perhaps some different models that are going on throughout the state, and I'm wondering, is that something we could start looking at here in Warren County?
We did look, because so many of, actually it really hit our adult services group very hard, the on-call reason for leaving, but most counties, not all of them, do have that. And the smaller the county that you are, the more, if you eliminate those like 8 people from being on call, that means that the other people are going to be on call much more frequently. So you may not be solving the problem that you're thinking that you're going to solve, because then you'll just have a lot more people stressed. So, I don't know, Cynthia, do you have anything to add to that?
Supervisor McDevitt?
I'm a little confused. The resolution is to fill the vacant position of Assistant Social Services Attorney. I get the generic discussion we've just had, okay?
Right.
But it's a very specific resolution.
Right.
Talking about one position, one person.
Right.
So is this a person that's on call on weekends?
No, this is a different person.
Okay.
This is our attorney that just came this year, and he did an excellent job, but he would like to make more money.
Sure, understandable.
And so he's going back to his private practice.
Supervisor McDonald, did I see your hand?
Yes, I'm just curious if there's something that, maybe the next meeting or the meeting after that, we could kind of bring to the table some possible solutions to make it a better workplace environment for those caseworkers. I'd like to try to find a solution for that. I don't want to see that happen next year.
Right.
Have our employees burned out, stressed out. Even if you're at home, if you don't even have to leave, just the nature of being on call, you're never actually turning off. You're always on, and that's
right.
After a few weeks of that, months of that, that's awful.
Right.
Well, correct me if I'm wrong, but I think we have exit interviews now, don't we, through HR?
Yes,
Maybe it's something we can bring up to Jackie or talk to Jackie about, but Supervisor Brown?
I mean, this is not a helpful comment, but a lot of it is they're dealing with child abuse situations that you can't possibly prepare for that in advance. I mean, to an extent they can, but yeah, people are walking into stuff on call that's probably really, really difficult to deal with. And I wanted to mention that the sheriff and I have been looking at something called Fight Crime, Invest in Kids, and it's supposed to help reach children who are at risk and help the adults I mean, that's where I see we need to funnel more effort at the root of the problem. In addition to helping our caseworkers so that they're not completely stressed out when they're responding to the problem.
And this is a statewide problem, that there's a lot of turnover, in caseworkers. The state is having trouble actually, keeping up with the need for, training because there's so much of a need that, it's stressing their training procedures. And there's a requirement also that for people that are CPS, they have to have it done in 90 days. And so because it's not just our county, but it's across the state that, that many people are just getting into the field, but then after a time are saying, I couldn't do this forever.
Supervisor Sheber?
Just a specific question regarding the resolution request. When we last looked at this, and Cynthia, press me if I'm wrong, I believe this was when you came to the board, you asked for an increase in the salary to match, someone was thinking of leaving, or to match something at the county attorney's office, so we increased the salary, hoping that, you know, that way we weren't back in this situation. And from what I'm hearing, you're citing a reason of salary, of why this person left, but we had already increased that salary to match what was it? It's a different position. So this salary was never increased? So you had 2 assistant social services attorneys, and one got paid more than the other?
Yes, that person had just started at the end of November, actually.
Okay.
So I don't believe that even in January, when increases were made, that position got an
Okay.
increase. But we're talking a significant difference between what we could afford to increase him based on, you know,
Okay.
what he could potentially make in private practice.
Okay, so
It wouldn't even make
it wouldn't make, that's what I was getting at. Okay,
But what,
so,
sorry.
well, I'm just wondering, just one last question, the salary we're going out at now, that's the salary it was before then?
I believe it might be raised about $1,000 for the range. He was at 62,500,
Okay.
62,500. So, that might have been the initial, but we did have a range in the last. This is very similar to what we had the position posted for last year.
Okay.
And if you recall, that was the position that, we took over the assistant county attorney part-time
Yep.
duties, which was child support and the juvenile delinquency and PIMS proceedings that we, had the children placed.
Okay, thank you.
Okay, we do have a motion and a second. All in favor?
Aye.
Opposed? Carried. Thank you.
Number 2 is a request to amend the county budget to reflect an increase of $5,900 to the Youth Bureau budget, special delinquency prevention. There was an increase in state allocation, so we're asking for that.
Okay.
Permission.
Motion made by Supervisor Frazier, seconded by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried.
Number 3 is a request for authorization for our foster care adoption caseworker to attend group preparation and selection model approach to partnership in parenting training in Albany, New York from November 1st through the 4th and 14th through the 18th. There's only one staff member right now that can do this training, and we like to train in pairs. It's essential that, when they do it, it's about an 8-week training, and it's just better if you have 2 people, because there are a lot of questions as people prepare to be foster or adoptive parents. So,
Okay.
I would move
Motion.
3 and 4.
Motion to move items 3 and 4 made by Supervisor Sieber, seconded by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried.
okay, now we need to discuss a little bit about, Countryside Adult Home. We were thinking about a title pay for the senior aides that we're doing some of the work that the director does, why, we're looking for one. But we were informed this morning that we can't give out a title pay for those senior aides to do some of the director's work. So we are going to, table this while we find a way that we can reimburse them for what they're doing right now. So we will be talking with, civil service to, told us we couldn't do out of title. So we'll try to figure out a way we can reimburse them for some of the extra duties they have.
Okay.
And then we'll be back next month, so it'll be retroactive.
Supervisor Huber.
Just, and perhaps this is a, question for our acting county administrator, but don't we have a pending resolution somewhere about doing work while someone is absent? I believe it was as a result of when you were out, Maureen, you see a building.
It's against civil service rules to pay people out of title pay, so.
So the resolution, we would have passed it.
That was for, people filling in as, for their, department head, right?
I thought it was interim, yeah, interim.
It's interim director.
That was like a deputy treasurer filling in for the treasurer or something like that. I don't think, but as far as civil service jobs, we can't do it.
Okay.
What we need to do is accelerate the, search for a director.
So this isn't as it relates to, why am I so confused here? Isn't this extra work because the position is vacant as director?
I think
Yes.
Amanda has an explanation for you, Rach.
Okay.
The resolution that we were talking about, that was
Yeah.
tabled, it was sent back to finance
Right.
and personnel and higher education, it's still sitting there.
Right.
We haven't done anything on it, it's
But
just a
this is
pending
an
item.
example of where that resolution would be
Mhm.
very helpful. So when are we gonna look at that resolution again?
Whenever, it's on the pending items list for finance, it's on their agenda every month, it just hasn't been discussed.
Perhaps it's something we could pass on to finance to take a closer look at then?
We can, speak to Ron about it, sure.
Supervisor Brammer?
My thought is, Rachel, on this one, there's no, deputy director or whatever. We'd have to, this policy still wouldn't apply because we have all these different people filling in, right?
Right. It's really because supposedly they wouldn't qualify for the position, so then we can't pay them, is what, Trish told me. But we do have to somehow reimburse them for some extra things they've done, I believe. So, we'll take a look at that and get back to you.
Well,
I think the resolution that's tabled, I'm just looking on the pending items, that's just concerning salary adjustments for deputy department heads when filling in for department head vacancy. And I believe the deputies are all outside of the bargaining unit, so that's
They
where
are.
that's allowable.
Okay.
In this case, this resolution wouldn't help because you're talking about people in the bargaining unit who are filling in, so that's where the disconnect is.
Okay, I appreciate that. I guess I'm just wondering, what happened to obviously we'll accelerate the search for that position, but what happened to the idea like teamwork, and is it because they're in the union and they can't do anything extra to help in the time of need when we
No,
have a
I think
vacant
that they
position?
really are trying to do that. I think it just, gets wearing the longer it carries on, and we don't have a candidate, and we are going to repost. So I think it's like, I think they feel a lot of responsibility. And it's not that they're like saying, I won't do this if you don't pay me, but they just asked if they could, if there was some way to compensate them. I think it's fair for them to ask, and I think it's fair for us to look at it.
so Tricia's looking into this then,
Yes.
President Dunn.
Yes, just for my own, frame of reference here, how long have you been kind of just ad hoc filling in?
5 weeks.
5 weeks. And still looking for a candidate?
Yes. We're gonna,
Have
repost, and we're going to put it in the paper.
Have we had people inquire interest and
They weren't,
wasn't what we were looking for?
I sent their applications over to Trish, 'cause she has to, look them over, and she said no, nobody was eligible.
Oh, okay.
So, we have to send it back out and see what we do.
Okay, so we'll hold off until next month,
Yes,
so hear more, okay.
okay, thank you.
Okay,
And Julie will review where we are.
For the overtime, we are up a little bit in hours. We, still have 2 people out in our temporary assistance unit, so we had to authorize overtime just so that the other workers could catch up on some of the work. We have a little bit of training going on with new caseworkers. So overtime's probably gonna be ongoing for a little while anyway. And then on revenue and expenditure, our expenditures ending the third quarter of this year were pretty much on target. Revenue is starting to come in generally the last half of the year. It does come in a little better, so I'm hoping that'll be on target as well.
Any questions or comments? Is that all you've got for us, Maureen?
That's all I have today.
Thank you for coming.
Thank you.
You guys have a good week.
You too.
Yeah.
Why can't we change the
Yeah, I don't.
requirements to make someone eligible? Like, are they good candidates or just like some weird reason they're not eligible? Because there's
Yeah.
certain rules about civil service, if you don't meet those
Morning.
requirements, they work out ways of trying to change
I,
that.
Good weekend.
see you at 2 o'clock.
And then can you give like a time off award or like,
I got you.
that, is that okay when that?
I don't know anything about that.
Yeah.
They need a professional. This.
How are you?
Good morning, good, thank you.
And I don't
We're
know.
trying. Apparently there's money out there.
Maureen is so much of a strainer herself.
You know, before I do that, really seriously, the state is like, where's all our tax money? That's into us.
Yeah, she has to sit up there.
Get forewarned,
You know they have to
Joan reminded me this morning.
After them all.
I'm after it.
No, I did the same thing.
That's right.
We had one person here at 9 o'clock.
I'm trying, Matt.
One of those days.
Very sick on this kids thing.
Okay, we'll keep going here with public health. Pat, take it away.
Okay, we have, our health educator, emergency preparedness coordinator, wellness committee chairperson, Dan Durkee here this morning, and he's, going to present a resolution for the wellness committee, so he may be free to leave after he does that.
I know Amy set it up, Amy Klug helped me put this together, first time here doing this, so. The wellness committee, has been working to try to bring just low cost, no cost things to the county employees. And one of them we brought was, the Juniper Hill Farms, Farm to Desk program, and that's been a pretty good program, but we actually have come across something else that we wanna not change what we're doing, but actually extend the program to a year-round program. It's something through Field Goods, so, you have the resolution there, but basically Field Goods is what does the,
Which one is it?
oh, I'm sorry, resolution request form number 3, it's, I apologize.
Okay. I just wanna look at it while you're talking.
Yeah, sure. And there were a couple of other pieces that were sent out to the committee members, just a couple of program overviews and things like that.
Yeah, and it's not in the packet,
Oh,
because
it's not.
that wasn't part of our agenda, so that's why it didn't.
Was that not, did we not get an email with that, though? That's what I
Yeah.
thought, I remember reading about it.
Yeah, I know we had sent it out last week when it,
Right.
I wanna say Tuesday or Wednesday, we had sent stuff out,
You did.
Do you want me to make a couple copies?
if you want, sure, I could've brought more, I didn't even.
Oh, yeah. Oh, do you have it?
I have a copy of it, but I don't have more than one,
We got it by email on Friday.
Okay.
Preservative.
so.
Wouldn't that be a lot easier with a
I know.
Oh, it's funny you
I
mention
can't
that.
wait.
I gotta pull that out right out there
Yeah,
too.
feel good.
But I can still see it.
No, they're
better
both
in
there.
your eyes than I do.
You're good, Dan, keep going.
Okay, so anyway, so what happened is, I was at another health fair and, I ran into the Field Goods group, and what they do is they do the desk part of the Farm to Desk program, so what they do is they contract with a lot of local farmers, over 80 different farms, and they do the delivery piece of the program to the different work sites. So, Juniper Hill does that right now. Unfortunately, there's a big upfront cost for any employees who wanna participate. Again, there's no cost to the county here or anything, it's all voluntary. But what it is, it provides opportunity for fresh produce, local produce, to be brought into employees without them having to go to a farmer's market, which, again, sometimes is inconvenient depending on where they live. The costs are sometimes higher. These programs are usually lower because they know they already have a sale, so they don't have to boost prices in case they don't sell the product, which is what happens at farmers markets. So Field Goods, again, works with 80 different farms, and they do the delivery piece of it. So what they do is they provide between 5 and 8 or 8 to 10 different goods that employees can subscribe to. Again, it's something they have to do on their own, but what's nice about it is you only pay for the weeks that you use, whereas a farm to desk, you pay a share up front, and you basically have to spend down that share before the end of the growing season. So Juniper Hill goes 20 weeks, and if you don't spend it, it kind of gets rolled in, and it's part of the cost of operating the farm. So they use that as their credit to get the seed and everything else to start it. So this one is slightly different in that, again, it's not a big upfront cost. It's year-round, and they can stop their subscription whenever they want. They can suspend it for a while, then start up, so if there's nothing they want. So again, it's an option for employees to be able to continue with the farm to desk, support local organic growers. Again, we're looking at, and help anyways, trying to keep things more locally instead of bringing it across country and things. So we were looking to try to bring this in as an extension of the current farm to desk program and allow it as a year-long, once-a-week delivery to employees. Again, when we looked at it, it would look very similar to the contract that's already with Juniper Hill. It would just kind of be modified to list the Field Goods program with that.
Supervisor Brammer, motion?
Yeah, sure.
Okay, seconded by Supervisor Seaver. Any questions, or go ahead?
Do you have the list of the farms that they're using?
If you go online, you can actually see the list. It's mostly eastern New York. Because they're located towards Poughkeepsie, they're not quite that far, but they do have a couple of farms for fruit that come out of New Jersey, and then they actually have Juniper Hill, who does our farm to desk, as one of their farms to the north. So they're the eastern part of New York, and we did make sure, and they do say they're local, they don't want to expand beyond local, so there's a lot of farms locally within, I don't know if Warren County has any, they might have a couple of small, but a lot of the Washington County farms are in there as well, the Argyle farms as well. So, like I said, again, the nice thing is it's year-round, so it allows people to buy local. It supports our local economies, and it's at no cost to the county. It's just an option for employees who want to participate and have access to that fresh food, where supermarkets can be tough to navigate. And you know where this comes, and each week, whatever's in that bag, they actually get a list of the farms and what it's providing, so.
Okay, we have a motion and a second. All in favor?
Aye.
Opposed? Carried. Good job, thank you.
Guys.
Can I just ask Dan a question?
Sure.
I know you, I always wait with interest your smoking cessation program with the young students that come in, and
Yep.
we, as you may know, we are involved in a
Yep.
smoking issue with county employees right now, and we had a group from Glens Falls Hospital attend our meeting on
Yep.
Friday. I guess, as far as trying to get into the end zone with this issue, in terms of trying to come to a mutually satisfactory solution of getting people to stop smoking, as well as providing you might say, a window of getting them to that point.
Yep.
Do you have any magic words of?
Do I have any magic words? I think it's always gonna be a hot button issue, but in my mind, it's the way to go. Again, from a public health standpoint, just from a practicality standpoint, from a cost standpoint, at some point, you're gonna pay for those smokers through either illness or increased insurance premiums. I can tell you right now that there is a smoking cessation program that we're bringing on for free through Blue Shield. It's gonna start November 8th through November 28th, whatever that Tuesday. So it's gonna run once a week for 4 weeks, during the noon lunch hour for any employees, whether they have the insurance or not. We're gonna provide it. Again, it's a free service, and Blue Shield's gonna be providing that. As well as the hospital, when they do their 4-week cessation programs, we do put those out as well. So we are providing those opportunities. We've also the Wellness Committee has put together a list of resources, as well as what the insurance provides for those who have insurance, because they do have a nicotine replacement program that is part of the benefits you're already paying for. So any employee who wants to take advantage of that, who has the Blue Shield insurance, we've put that information out in emails as well, and kind of made sure that department heads have seen it, and hopefully it's getting to all the employees who would take advantage of it. Again, personal choice is something you look at, but I think on public grounds, and we're not the first county by any means, or the first municipality to look at this issue and say, the benefits outweigh the costs, so, you know, as a public health person, I support it, and, you know, again, not everybody's always gonna be happy, there is no, you know, everybody's gonna have it, and in terms of enforcement, I know that's always a question too, how do we enforce it? A lot of these are self-enforcing, people see it and they adapt, and they say, okay, I understand it, I may not always agree with it, but most of them, and talking from my counterparts in other counties, they say, you know, you're never 100% compliant, and that's the nature, I mean, we can't do it with cell phones and cars, you know, so, I think it's a noble cause, I think it's worth pursuing, so that'll be my 2 cents.
Thank you. Appreciate it.
Thanks, yeah, Dan. Okay, Pat.
Thank you.
The first thing on our agenda this morning is we would like to request a resolution to authorize a memorandum of understanding with RSVP of Warren and Washington counties, which is a volunteer program sponsored by Tri-County United Way, to allow our agency to become a community partner in a form approved by the county attorney. This is going to allow us the ability to utilize volunteers for like emergency preparedness or flu clinics or helping people, that kind of thing. But we have to have something signed in order to do that. And doing my research, I find that there are some other departments in the county that also do that, so our county attorney is going to address that.
Sure. Right now, there's a resolution for each department, so we just thought to maybe streamline the process. The board could pass one resolution that allows any county department that wanted to also sign the MOU. So that's really it. We would do one resolution for all county departments instead of for each department separately.
And that one resolution will come from this committee?
Yes.
Or we're gonna do it at the big board meeting?
I think the committee should pass it and then it would go
goes
to
on
the
to full
Okay.
board.
Motion made by Supervisor Seaver, seconded by Supervisor Vanslo. All in favor?
Aye.
Opposed? Carried.
Okay, it's been suggested by the county attorney's office that, I would, request a resolution to authorize the Director of Public Health and Patient Services from time to time to enter into and execute agreements with various vendors and contractors regarding needed services for the Health Services Department for an aggregate amount not to exceed $5,000, and you can put any amount on it in a fiscal year, in a form approved by the county attorney. Recently, this came to our attention because we had to get somebody to come in to fix our autoclave, which is what we do to sterilize our medical supplies. And up until now, we've just had the guy come, he fixes it and sends us a bill and we pay it. But I guess when the auditor came, they're looking now to have everything that we pay, no matter what it's attached to, whether it be maintenance agreements, have to be attached to some kind of a resolution or a contract. And in speaking with the county attorney's office, some of the other departments already have this in place. And actually, I did know about this, and I don't like to have anything authorized for me to sign, but that could go through committee, because it's just a little safer. But with these kind of things, it holds up progress. If we would have to, every time we need something fixed, we have to wait to go to committee, and also to have the person actually come and do the work, to have them wait that long.
Motion made by Supervisor Seaver, seconded by Supervisor McDonald. Any discussion? All in favor? Opposed? Carried.
Moving on, we would like to request a resolution to accept a grant from the Adirondack Rural Health Network / Adirondack Health Institute in the amount of $2,500 to plan and carry out a neonatal abstinence syndrome program. Warren County is part of the Hometown versus Heroin Coalition, and part of the mission of this coalition is to promote mental health and prevent substance abuse and promote healthy women, infants, and children, and this program is going to assist in meeting those goals.
Okay, motion made by Supervisor McDevitt, seconded by Supervisor Britton. All in favor?
Aye.
Opposed? Carried.
In follow-up to that, we would also like to request a resolution to amend the budget to reflect the acceptance of those funds.
Okay, motion made by Supervisor McDevitt, seconded by Supervisor McDonald. All in favor?
Aye.
Opposed? Carried.
Okay,
Oh, I'm sorry. Supervisor Brock, question.
What is neonatal abstinence program, what does it mean?
The neonatal period is like during the pregnancy period, when we wanna have women
Oh,
not
oh,
take
right.
options. I don't know, Janelle, do you have anything more that you wanted to?
Well, it's just a big deal when these women are using substances before the birth of their baby, and then when the baby's born, the baby then goes through an abstinence syndrome or withdrawal syndrome. I mean,
Oh, okay, okay.
it's neonatal abstinence syndrome, which is what we're trying to prevent, but,
Right.
the withdrawal is kind of the thing
Right.
and there's different, like, scales to detect that, and we've done a lot of collaborative efforts with the Snuggery, with the OBGYNs, with the pediatricians, with community, with DSS to try to kind of come up with a network to handle these families. With heroin, even when you recover, you're taking a medication kind of for the rest of your life to prevent that relapse, and when these women are taking it during pregnancy and have the baby goes through withdrawal, so that's kind of the premises of the subcommittee of the heroin versus task force.
Todd, you want to talk about the transfer of funds?
Attachment number 6 is our transfer of funds for this month. I just have 3 right now. The first one is our Ebola grant ended September 30th, and the person in that was working 4 hours a week, we've asked the bioterrorism grant if we could take on those hours over on that grant, and they approved that. So it's just moving the money from the Ebola grant over to bioterrorism to get us through in the last quarter of the year. The second one is moving money again from our full-time salary line to our part-time salary line within the home care. Hopefully that's the last one. Will get us through to the end of the year, and we'll cover all our per diems that we've been utilizing very well throughout the year. And the third one that I'm requesting is just a minor detail, and for whatever reason in Dan's program, it's a one-person program, but the salary always ends up being a little bit from budget under, and then we end up with a negative. So I'm just moving $125 as my guesstimate to get us through to the end of the year. So those are the 3 changes that I've had.
Okay. Motion made by Supervisor McDonald, second by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Okay, we would also like to request a resolution to enter a contract agreement with Anatasha Abrantes, to provide occupational therapy services, and OT services are reimbursable.
Made by Supervisor McDevitt, second by Supervisor Vanslo. All in favor?
Aye.
Opposed? Carried.
Okay, we would also like to request committee approval to allow Tammy, our fiscal and clinical informatics coordinator, to attend the Home Care Association of New York State Quality and Technology Symposium on November 16th and 17th in Saratoga Springs. And the conference is going to focus on a lot of integration of payments and all of the financial stuff that we need to be sitting in the audience to hear about.
Sounds exciting.
Yeah,
Yeah, exactly. We need a motion to get this on the floor, made by Supervisor Frazier, second by Supervisor McDevitt. Any discussion? All in favor?
Aye.
Opposed? Carried.
Okay, we have no referral, no pending items this month, and regarding information for discussion, in your packet, you'll see attachment number 1 for our monthly emergency response and preparedness activities. Anybody has any question on that? If not, we can move on to status of referrals, and our last, you'll see that we're down this month again, and we which and we wane, but I would ask Val and Tammy to comment on what's been happening. Go.
Our referrals, for the month of September have gone down, but if you look at the list, I believe in your packet there, it seems like the month of September, they have shown that they have gone down. I did talk to our liaisons at the hospital and some other of my colleagues that I have, that does, the same position that I currently do, and the general census in the hospitals are down. Glens Falls Hospital, had been down to 130, which is very low. And then on this past Thursday, I talked to them, they were up to 191, and they're scrambling now to find, to get patients admitted to home care. And I know I could account for probably 5 referrals that we were unable to take. The physician's offices now, primarily Hudson Headwaters and Iron Gate, are doing a fall risk assessment on a lot of their patients that go into the hospital or go into their office for their physicals. and they've made referrals. Unfortunately, the state is making, quite a bit of mandates that what we need to have, and just to send out a physical therapist, just to go over, does somebody have, throw rugs or carpets or things like that, that's nothing that insurance is going to pay for, so we have not been able to, take those on. The state is really pushing for fall risk, especially with our elderly, and I think the doctor's office has established this program to try to prevent, the falls and stuff like that, but those, we can't. We've tried to get around it a little bit for asking for, improved, documentation from the doctor's office so that we can get authorization from insurances. If the person has had a fall, that's different than the person is at risk for a fall. So if they've had one, we're asking the doctor's office, please include that in your referral, so that we can get those issues covered. But as of last week, we started calling back, we had cut down a little bit on the per diem. And last week I had to call them all in on Friday and again all in today, so hopefully we're back on the swing.
But the good thing is, when we don't have need for the per diem, we don't have a staff person there just sitting there waiting for the referral to come in, so that's a better plan. Okay, Ton, you wanted to talk about expenditures and...
Okay, attachment number 2 is our current fiscal status right now, and, you'll see, we're pretty much on target right now. We're in the process of doing our quarterly grants for the July through September, so only a few of them have been done and approved, and we also just closed the books and for the month of September, and I accrued that revenue of $265,000. Regarding payroll again, as we talked about, you'll see that our regular salaries are down over 10% from last year. Our overtime is down from over 19% from last year, and our per diem or part-time salaries go in that line are up 13. So you'll see that this per diem is really helping us overall with our overtime and regular time salaries. We are 68.7% of our budget right now with salaries. Last year at this time, we were at 77.21%. So you can see where the big changes helped with our per diem. On attachment number 3, which compares last year at this time to this year, again, pretty much you'll see where the salaries are down. That's pretty much spoken. Contractual salaries, last year we had long-term care in there, and that program is gone, so those expenses, and again, primarily I feel it's our early intervention and preschool invoices, just catching those up and getting those in, but on target. And our revenue right now, after posting our September revenues, we're pretty much on target with that too. So right now, so far so good.
Excellent.
Okay, that's all we have, unless anybody has any questions.
Anything from the committee for public health? Other supervisors? Okay, motion to adjourn. Motion made by Supervisor McDevitt, second by Supervisor Bramer. All in favor?
Aye.
Opposed? Carried.
The public vote.